Coming in, I'm performing hand hygiene. I'm closing the door for privacy, and I'm acknowledging Son and Father.
Again.
Good morning. Good morning.
Good morning.
How are you today?
Okay.
Good. I'm Brenda. I'm going to be your nurse today, and I'm going to do some of your checkup. And what is your name?
Andrew.
You're Andrew? What's your last name?
Alvaro.
How old are you, Andrew? 5 years old? Do you go to school? What school do you go to?
Thunderbolt.
Thunderbolt. Yeah? And what grade are you in?
I think for
Third? Mr. Navarro?
Yeah, no, he's going kindergarten.
Kindergarten. Okay, in Thunderbolt. That's cool. That's a cool school. Let me take a look at you. Looking at the child, he seems well nourished. Skin doesn't show any kind of lesions. A little scoriation here, but this seems to be some kind of rough play that might have happened. Hair is very nice, shiny. I'm going to go with my hands around you like this, okay? You like that? Okay. Scalp is clean. No signs of infestation. I'm going to palpate for any masses or lesions. And there's no signs. No sign of that. And I'm going to go ahead and take a look at your hand. Can I have your hand? Can you put your hand on my hand like this? Yeah. Let me take a look at one thing. I'm going to do a little pinch. Ready? Capillary refill is under 2 seconds. Skin turgor, elastic and taut. And let me take a look at your eyes. You've got pretty eyes. What color eyes do you have?
Blue.
Blue. You want to play the game? You're going to look at this. Ready? But I'm going to shine a light at you, actually. And you're going to keep your eyes looking right here at my nose. And when I shine, you don't close it, okay? But look here at my nose. Ready? Pupils are reactive. There's perla.
You like that?
I can let you try. You can try. You just have to press right here. Ready? Actually, it's here. No, it's not. It's here. Silly me. Yeah?
Can I that?
I can. There you go. You know better than I do. You press in the best place better. Okay. All right. Now, take a look here. You're going to follow this pen here, okay? So if I'm going to bring it right here, you're going to look right into it. That's really good. Now follow only with your eyes. Follow where I go, okay? No, with your eyes only. Simon says, move only your eyes. Ready? This way. Just your eyes. Okay. Neurologically speaking, he's fine. He follows the instructions. Also, cranial nerves 3, 4, and 6 are intact. Can I, since I have this here, can I look up in your mouth? Can you stick out your tongue? Can you say, ah? Can you put your tongue out like this? Okay.
Can I take two?
The ventral is nice and shiny. And the bottom, the dorsal, you can see the veins.
Can I
He
take?
has all 20 teeth. They're white. Go again one more time. Ah. The uvula is midline. And also there's the presence of the heart and the soft palate. And when he says ah, in a moment. And when he says ah, the uvula and the soft palate rise together. And right there, cranial nerves 9 and 10 are intact. His nose is midline. Also his eyes, they are in good direction right here. Lips are pink, moist. And the gums, they are tight around the teeth. And the oral mucosa is, let me see. Open your mouth again. presents no lesions, it's intact. Okay. Let me take a look at your eyes here. Can you look up? Yeah. Nice and rosy. Okay. Now, Andrew, let me take a look at what your temperature is. Do you know what this is? What is this?
A temperature.
It's a thermometer, and it's to check your temperature. Okay? So I'm just going to put it like this on your head, and then I'm going to bring it all the way here, and then I'm going to bring it all the way here. Okay? Ready?
It's gonna tickle.
It's going to tickle just a little bit, I promise. Here. Bring it all the way here, and the back. And the reading is 97.3, and that's a perfect temperature. Okay. Can I take a look up your nose? Okay, it's pinkish, it's moist. Can you also do this? Can you hold your finger here and and blow? Just hold it and blow the other way. Like this. Very good. Now do the same. So both nares are patent, and that's good too. All right. Can you shrug your shoulders? Shrug your shoulders. Do like this. I'm gonna try. I'm gonna try to hold it down, and you're gonna try to bring it up. Okay? Right. Go. There you go. Good. Can you hold my hand? Can you squeeze my hand? Look, my two fingers. Can you squeeze them? Squeeze them. Okay. Strength is 5+ bilaterally. Can you pull my fingers? Oops, careful there. Okay. Can you push my hand? All right. Push and pull strength is 5+. Okay. Don't go falling down now. All right. Let me take a look. There are no masses. Trachea is midline. All right. And he passes also for the neurologic system. Let me take a look. You see this? You know what this is? What's this? It's called a stethoscope.
A stethoscope.
You can hear. I can hear your heart with it.
Can I hear my heart?
I let you. You can do it with this one, and you can try it on Mickey Mouse. Did you see my friend here, Mickey Mouse?
Yeah, I saw him with Pluto.
Okay, that's good. So let me do this here. This is one that I use for children. And you can put it here in Mickey's heart. And you hear bum bum, bum bum, bum bum, bum bum. Okay? Ready?
Now, can I do it to Pluto too?
Yeah, you can do it to Pluto, but let's do this right after I finish with you. Is that okay? Because I know that your dad probably wants to go home. Is that true, Mr. Navarro?
Oh, yes.
What do you do for a living, Mr. Navarro, if you don't mind my asking?
Sure, I work for Fidelity.
Okay. Is that a finance company?
Yes.
What's this one?
Oh, this one is I'm going to be using on you too. I'll show it on Mickey as well, okay? But hang in there.
What will you use this one? What will you use this
We're going to
to
use
Mickey?
all of them.
And we use this one to Pluto.
Can you show me if you can breathe well? Does it hurt? No?
It's how I'm breathing.
What's that? It doesn't hurt when you're breathing. Okay, good. So I'm going to hear you breathing, okay? I'm going to listen to 10 points in the back and the 8 on the front. Okay, take some deep breaths for Mom, okay? Take some deep breaths for me, please.
Is it done yet?
No. Ready? Keep on breathing. Breathe normally. Normal. Well, I would normally take off his shirt, and of course I'm listening to rustling, but in a setting, he would not have his shirt on, and his lungs are clear. No signs of bronchi or wheezing, and they're clear bilaterally.
A tummy aching?
You have a tummy aching?
No.
No? Okay, good. Now I'm going to hear your heart. Okay? So the heart, we're going to listen aortic on the second intercostal on the right. Then we're going to listen to the pulmonic on the second intercostal on the left. On the third intercostal, we're going to listen to Erb's point. On the fourth intercostal, we're going to listen to the tricuspid. And then on the fifth intercostal, midline, we're going to listen to the mitral valve, to mitral. And then, let me see. Ready? I'm going to put this inside, okay? See if I can do it like this.
If I measure into my belly,
That's a strong heart. And then here, the mitral, I would look for a full minute. And at this point, I hear S1 and S2. Very good. How do you feel? Strong like a superhero? Yeah. Okay. Now, the cuff that I have is a little bit too big, so I'm going to try. This is a cuff for blood pressure.
wow, so you're doing it like this.
We're going to do this. We're going to put it round like this.
Can I do it to Mickey?
You can do it to Mickey afterwards, but I want to show it on him and then on you. And I'm going to pump, 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 pump. And I'm going to listen. And it's going to tell me your blood pressure, which is going to make some sounds. You want to feel it? You're going to feel your arm going. It's going to be real cool. Ready?
Wow, so I am
Can you
not
put your arm like this to me, please? For me? Thank you. I don't know if it's going to work, honestly.
Me too.
Give me your arm, please.
It's up here.
I think it's a little bit too big.
Maybe.
Maybe not. Okay. Ready, Andrew? Can you keep your arm like that? Now I'm going to put the stethoscope on.
I'm going to take all of it.
Hmm?
I think it's going to take all of it.
Yeah?
Because I have a butt. Oh no.
Okay, so in a setting, in a clinical setting, we would have the right cuff size for a child. And the last time that I saw his blood pressure was 97 over 57, I want to say, which is normal for a child. Now, I'm going to go ahead and listen on his radial. I'm going to try to feel your pulse. Ready?
It's still going. Let's see.
Okay, just for a matter of timing, I counted about 15 seconds, 15 heartbeats. So for the sake of this assignment, I'm going to say that he has approximately 60 heartbeats per minute. Yeah? Okay. And both radial pulses are 2+. Can you hang it like this? Let me see.
You can also see my boo-boo.
Yeah, I see your boo-boo.
I think.
Also pedis dorsalis.
I think a cat.
Is it 2 plus?
scratched it. I
A
think
cat scratched it?
it maybe.
Oh no, we have to take a look at this so it doesn't become a bigger boo-boo. Alright. And I'm gonna do this. So, looking at his, if I were to have labs, I would say that his hemoglobin, and white blood cells count, and red blood cells count is about within normal parameters. And what? And I just want to go ahead and check your tummy. Can I check your tummy? Can you lie down here for a moment?
Yeah. I'm so tired.
You're so tired. Can I raise up your tummy like this? Your t-shirt? Okay. His stomach is you don't have to pull in your air bit. His stomach is flat. So we're going to auscultate it first in all 4 quadrants. Starting from the bottom.
It hurt at all.
Yeah, nice and gurgly. About 4 gurgles, give or take, per minute. Now I'm going to palpate your stomach, okay?
What's happening?
I'm doing this. Feel it? Does it hurt? No? Do you feel anything?
It makes me that I'm laying on a beach.
Really? So it feels comfy? Okay, there are no lesions, no signs of masses, and no pain. And he has bowel sounds in all 4 quadrants. Hold on a second. I'm not able to palpate the liver. Does he have any kind of issues with his stomach?
No.
Does he eat? You can sit up now. Does he eat well?
Yes, he does. He eats. Must eat some veggies, lots of fruit, lots of junk food also, but
Lots of junk food?
Maybe.
yeah, more than what he should.
And probably it's time to not have so much junk food.
Yeah.
Yeah. Right?
Like, my.
He eats fish, chicken, meat.
What do you do to promote his healthy lifestyle to him as far as exercises, or
We go play. He has a bicycle. He has a scooter.
does he do any sports, aquatic sports?
No,
Yes, I do.
he loves to be on the scooter and
Okay. How is his progress in school?
he's okay. He's doing good.
He seems to be a very friendly child, is that it?
Yes, he's very friendly. He's very
How
easy
about
to
the
get along.
socializing? Oh, you're in love with me. No. I'm married to him. He seems to be Does he socialize well?
Yeah, he does.
Okay. Is there anything that you are worried about him?
No,
No. Any medication that he takes?
no, he's not taking any medication. He takes vitamins.
Vitamins. Okay. Why do you give him vitamins?
The Flintstone vitamins. Oh, why?
Yeah.
Because I think it's good for him if he eats. He helps complement the fruit and the veggies.
Does it come with iron?
I think so.
Yeah. Okay. That's a good thing. Oh, I forgot this.
Why?
Look at this. Do you see my picture here? And there was the reflux. And I do it without him noticing, so he can actually have a real reflux. Did that hurt? No, it didn't?
Because
Okay.
I was like this.
Hmm?
Because it was like this.
Okay. Does he have any anything in the household that might cause any kind of stress to him?
No?
And you have lots of friends? Okay.
And anything dinner hurts when I put it in things like I put it in flashback and it hurt because like
Do you notice or think of any notable development delay or anything that worries you on him?
At all? No, he's a pretty smart kid.
Okay.
He's just distracted all the time, and his attention span is short, but that's pretty normal for his age, I'm pretty sure.
Yeah, that I guess that would be. Just keep an eye. Nurse. Mm-hmm.
Do you know sheep get oil for you and cows get milk for you?
I know that. Tell me something. Do you sometimes feel scared or do you feel angry?
I feel happy all the time and I'm not even scared.
Really? How does he cope with stress? Some children, they have a blanket. Other children suck their thumb.
He sucks his thumb all the time, especially at nighttime.
Especially at nighttime. Oh, yes, I can tell. Yes, that's going to be bad for your teeth. They're going to come all the way up front. You don't want that, do you? Okay. So at this point, this would conclude my assessment with him at a first time. And just one last question: relationship with other children and other people in the family. Is it okay?
Yeah, he's fine with other children. He's really friendly.
That's great. So he is, all in all, a very healthy child, and that concludes my assessment for pediatrics.
All right. Thank you very much.